We are now down to the last component of our subject mappe, which is health. Quarter 2, Module 2, the pregnancy, responsible parenthood, and modern family planning methods. Here are our learning objectives. Number 1, analyze the importance of responsible parenthood. And number 2, enumerate modern family planning methods, both natural and artificial. Let's get started. But before we proceed to our discussion proper, let us watch first the process of fertilization.
Fertilization is the epic story of a single sperm facing incredible odds to unite with an egg and form a new human life. It is the story of all of us. During sexual intercourse, about 300 million sperm enter the vagina. Soon afterward, millions of them will either flow out of the vagina or die in its acidic environment. However, many survive because of the protective elements provided in the fluid surrounding them. Next, the sperm must pass through the cervix, an opening into the uterus. Usually, it remains tightly closed, but here the cervix is open for a few days while the woman ovulates. The sperm swim through the cervical mucus, which is thinned to a more watery consistency for easier passage. Once inside the cervix, the sperm continues swimming toward the uterus, though millions will die trying to make it through the mucus. Some sperm remain behind, caught in the folds of the cervix, but they may later continue the journey as a backup to the first group. Inside the uterus, muscular uterine contractions assist the sperm on their journey toward the egg. However, resident cells from the woman's immune system, mistaking the sperm for foreign invaders, destroy thousands more. Next, half the sperm head for the empty fallopian tube, while the other half swim toward the tube containing the unfertilized egg. Now, only a few thousand remain. Inside the fallopian tube, tiny cilia push the egg toward the uterus. To continue, the sperm must surge against this motion to reach the egg. Some sperm get trapped in the cilia and die. During this part of the journey, chemicals in the reproductive tract cause the membranes covering the heads of the sperm to change. As a result, the sperm become hyperactive, swimming harder and faster toward their destination. At long last, the sperm reach the egg. Only a few dozen of the original 300 million sperm remain. The egg is covered with a layer of cells called the corona radiata. The sperm must push through this layer to reach the outer layer of the egg, the zona pellucida. When sperm reach the zona pellucida, they attach to specialized sperm receptors on the surface, which triggers their acrosomes to release digestive enzymes, enabling the sperm to burrow into the layer. Inside the zona pellucida is a narrow, fluid-filled space just outside the egg cell membrane. The first sperm to make contact will fertilize the egg. After a perilous journey and against incredible odds, a single sperm attaches to the egg cell membrane. Within a few minutes, their outer membranes fuse and the egg pulls the sperm inside. This event causes changes in the egg membrane that prevent other sperm from attaching to it. Next, the egg releases chemicals that push other sperm away from the egg and create an impenetrable fertilization membrane. As the reaction spreads outward, the zona pellucida hardens, trapping any sperm unlucky enough to be caught inside. Outside the egg, sperm are no longer able to attach to the zona pellucida. Meanwhile, inside the egg, the tightly packed male genetic material spreads out. A new membrane forms around the genetic material, creating the male pronucleus. Inside, the genetic material reforms into 23 chromosomes. The female genetic material, awakened by the fusion of the sperm with the egg, finishes dividing, resulting in the female pronucleus, which also contains 23 chromosomes. As the male and female pronuclei form, spiderweb-like threads called microtubules pull them toward each other. The two sets of chromosomes join together, completing the process of fertilization. At this moment, a unique genetic code arises, instantly determining gender, hair color, eye color, and hundreds of other characteristics. This new single cell, the zygote, is the beginning of a new human being. And now the cilia in the fallopian tube gently sweep the zygote toward the uterus, where he or she will implant in the rich uterine lining, growing and maturing for the next 9 months until ready for birth.
Now let's get to know what is pregnancy. Pregnancy in a preconception health. A woman's lifestyle affects the quality of her pregnancy. Preconception health is a woman's health before she becomes pregnant. It means knowing how health condition and risk factors could affect a woman or her unborn baby if she becomes pregnant. Food intakes, habits, and medicines before conception are some of the factors that may affect the development of a baby in a mother's womb when she already decides to conceive. Now, what is preconception? From the word pre and conception. Pre means before, and conception, where sperm cell and egg cell unite in a process of fertilization. Therefore, preconception meaning before getting pregnant. Preconception health and care helps improve pregnancy outcomes and women's health in general through the prevention of disease and management of risk factors that affect pregnancy outcomes and the health of future generation, according to Uppsala Journal of Sciences. Now here are the practices to boost preconception health. Number 1, observe preconception diet. You have to eat more on calcium and protein-rich food, complex carbohydrates, healthy fats, fruits, and vegetables. Number 2, take 400 to 800 micrograms of folic acid every day. Number 3, stop smoking and drinking alcohol. Number 4, if you have a health condition like diabetes, epilepsy, oral health, and etc., be sure it is under control and it may affect a baby's development. Number 5, talk to your doctor about any over-the-counter and prescription medicines you are using. Number 6, avoid contact with toxic substances or materials that could cause an infection at work and at home. Post-pregnancy. From the word itself, post, meaning after. Number 1, birth. The passage of a baby from its mother's uterus to the outside of her body is called birth. During birth, the uterus contracts many times and pushes the baby through the vagina and outside the mother's baby. Labor is a process that lasts from the time contractions start until the delivery of the baby and the placenta. Labor lasts a different amount of time for every woman and every pregnancy. There are 3 distinct stages of labor. The stage 1, the cervical dilation. Stage 1 lasts from the initiation of labor until there is full dilation of the cervix. The cervix will become thinner, a process known as effacement, and stretches or dilation as the baby's head will descend and engage with the pelvis. This process of contractions, thinning, and stretching is usually painful for the mother. Stage 2. Expulsion. This is from the time of full dilation of the cervix until the baby is delivered. Stage 3. Delivery of the placenta. The third stage lasts from the delivery of the baby until the delivery of the placenta and the membranes or after birth. Now we have our newborn screening or NBS. It is a simple procedure to find out if the baby has a congenital metabolic disorder that may lead to mental retardation or even death if left untreated. Most babies with metabolic disorders look normal at birth. By doing NBS, metabolic disorders may be detected even before clinical signs and symptoms are present. As a result of this, treatment can be given early to prevent the consequences of untreated condition. Disorders treated for newborn screening. Number 1. Congenital hypothyroidism or CH. Number 2. Congenital adrenal hyperplasia or CAH. Number 3. Galactosemia or GAL. Number 4. Phenylketonuria or PKO. And number 5. Glucose 6-phosphate dehydrogenase deficiency or G6PD. Now we have breastfeeding. Breast milk is an essential substance that contains antibodies that help the immune system of the infant to be strong. Breast milk provides the ideal nutrition for infants. It has a nearly perfect mix of vitamins, proteins, and fats. Everything a baby needs to grow. Breastfeeding lowers a baby's risk of having asthma or allergies. Moreover, breastfeeding provides health benefits for mothers beyond emotional satisfaction. Mothers who breastfeed recover from childbirth and more quickly and easily. The hormone oxytocin released quickly during breastfeeding acts to return the uterus to its regular size more quickly and can reduce postpartum bleeding. Now we have here immunization or vaccination. Protects people from diseases by introducing a vaccine into the body that triggers an immune response, just as though you had been exposed to a disease naturally. It doesn't only protect your child from deadly diseases such as polio, tetanus, and diphtheria, but they also keep other children safe by eliminating or greatly decreasing dangerous diseases that are used to spread from child to child. After the birth of the baby, tons of challenges are faced by the parents, from feeding to diaper changing, cradling, and putting a baby to sleep. Aside from physical responsibilities, financial, emotional, spiritual, and moral responsibilities should also be taken into consideration in raising responsible children. Responsible parenthood pertains to the will and responsibility to respond to the needs and aspiration of the family. Responsible parenting, on the other hand, is defined as the series of decisions couples to make to ensure the best possible life for the family and for the community which the family belongs. It is the ability of parents to raise their children in a Filipino way and to satisfy social, economical, and religious responsibilities of the family. It includes the inculcation of values and instilling discipline, according to Population and Education Teaching Module 2009. Below is a diagram which enumerates the responsibilities of every Filipino parent. Let's take a look at this and analyze how responsible parenthood is carried out. Now here are the characteristics of a good parent or responsible parenthood. Number 1. responsible parents provide physical care and love. Number 2, responsible parents inculcate discipline. Number 3, responsible parents develop social competence. Number 4, responsible parents provide education. Number 5, responsible parents train children to become good citizens. Number 6, responsible parents teach children to be financially responsible. And number 7, responsible parents guide children to grow spiritually. As defined by the Department of Health or DOH, family planning is having a desired number of children and when you want them by using safe and effective modern methods. There are several ways of methods for family planning. Some of these methods do not only prevent conception but also protect both men and women from sexually transmitted diseases or STD or STI infections. Moreover, it plays an essential role in combating population growth, reducing poverty, which helps address the national concern on economic, social, political, as well as health and reproductive issues. Modern family planning methods in the Philippines are classified into natural and artificial methods. Natural methods are called fertility-based awareness methods, are means of contraception where a woman monitors and records different fertility signals during her menstrual cycle to work out when she is likely to get pregnant. The table below presents the common types of modern family planning methods in the Philippines. The natural method. Now we have here the calendar method, fertility awareness-based method are ways to track ovulation. Pull-out method. A man who uses withdrawal will put his penis out of the vagina before ejaculation, the moment when semen spurts out of his penis. Next, cervical mucus method. It is the method where a woman has to check the changes in her cervical mucus every day for the first part of her cycle until she is sure she has ovulated. Now, temperature method. It requires you to record your temperature in the morning every day before you get out of bed. Now, here is our artificial method. On the other hand, artificial method are any unnatural technique that is used to prevent conception. Number 1, intrauterine device or IUD. Is a tiny device made up of flexible plastic that is inserted in a human's uterus to prevent pregnancy. Next is implant. The birth control implant is a tiny, thin rod about the size of a matchstick. It releases hormones into a woman's body that prevents her from getting pregnant. It prevents pregnancy for up to 4 years. Depo or Provera, the shot. It is a birth control injection given by a nurse or doctor every 3 months. Pills. Birth control pills are a kind of medicine with hormones taken every day to prevent pregnancy. Condoms. A condom is a small, thin pouch made of latex or rubber or plastic or lambskin that covers the man's penis during sex and collects semen. Tubal ligation for women. Tubal ligation is a procedure to close both fallopian tubes to that sperm could not enter and fertilize the egg. During tubal ligation, the fallopian tube are cut, tied, or blocked to permanently prevent pregnancy. Vasectomy for men. Vasectomy is a surgery performed to block sperm from reaching the semen that is ejaculated from the penis. Let's have our short quiz. Good luck! True or false? Instruction. Identify the statement whether true or false. Write the word true if the statement is correct, and write false if the statement is wrong. Question number 1. Family planning is having the desired number of children and when you want to have them by using safe and effective modern methods. Number 2. Newborn screening is a woman's health before becomes pregnant. Number 3. There are 2 types of modern family planning, a natural family planning and an artificial family planning. Number 4. Responsible parents do not inculcate discipline. Number 5. Responsible parents provide education. Now, it's checking time. Now, here are the answers of our activity a while ago. For our question number 1, the answer is true. Number 2, the answer is false. For number 3, the answer is true. For number 4, the answer is false. And for number 5, the answer is true. Write your score over the total number of items. Congratulations and job well done.